Now, let us look at what are the goals of infection prevention and control. To prevent the spread of infections from patient to patient, patient to healthcare provider, healthcare providers to patients, healthcare providers to healthcare providers and to visitors, and subsequently or consequently, the goal is to protect patients from healthcare associated infections, resulting in improved survival rates, reduced morbidity associated with the infections, shorter length of hospital stay, and quicker return to good health. Let us look at what are the functions of infection prevention and control. In my opinion, the first and foremost, the function of infection prevention and control is to implement evidence-based practice, standards, and guidelines through setting specific policies and procedures, and to intervene directly to prevent infections, to provide effective occupational health programs, to educate and train healthcare workers, patients, and non-medical caregivers, to provide communication of infection-related issues and relevant practices to leaders and staff to facilitate improvements, to evaluate the program and improve it as necessary. The fundamental function or the functions are applicable, what all we talked about now are applicable to all settings where healthcare is being provided. It is regardless of the structure or hierarchy of the healthcare system, and the major responsibilities would include surveillance, continuous quality improvement, consultation, committee involvement, outbreak and isolation management, regulatory compliance, and of course the education and awareness. Let us look at the IPC practice of today. What are the major components of it? The major components are surveillance, outbreak investigations, prevention through practices guidelines like hand hygiene, use of barriers, especially the personal protective equipment, isolation precautions, construction, renovation, sterilization, disinfection, antibiotic resistance, blood-borne pathogens, food, water, air safety, cleaning, etc., etc. I would like to mention here that from all the mentioned practices, one big impact which can be immediately seen in healthcare settings is hand hygiene. Hand hygiene could contribute in a very big way to the prevention of infections within the hospitals. When we are saying about the policies and procedures, they are typically written, approved by some group, and shared with pertinent staff. And usually these policies may include all that what we talked about, including antibiotic use, education, occupational health, and then definitely the audits which had to be conducted in order to see the effectiveness of the practices within the given healthcare institution. So, after implementing all those infection prevention control guidelines and also getting those good practices into healthcare institution, what is the impact it can make? I think, in my opinion, the first and foremost is going to be the reduction in infection. That means the reduction in the human suffering. And of course, it is going to significantly contribute towards improving the survival rates, and it can reduce the morbidity associated with infections, which consequently is going to lead into shorter length of hospital stay, a quick return to good health, and definitely reducing the healthcare costs. It is not only about actually the costs related to these particular infections which are associated with healthcare, but a good infection prevention and control practice can have a very good impact on reducing the antimicrobial resistance. And a reduced antimicrobial resistance could have a significant impact not only at a healthcare level but even at community level, which automatically is going to make the communities healthier. And hence, following the infection prevention and control guidelines and putting those guidelines into practice is very essential to make our healthcare system a very safe and very effective and quality oriented. So, now let us look at what is that you need to follow up in terms of learning so that you can get the maximum benefit out of the module which has been presented today. You are expected to review the handout which is provided for this module and then read additional material which has been mentioned as reference material, and then consider discussing the topic among the participants. I am sure you would find within this module a group where you can interact online with your other fellow students. And we will also actually encourage you to join infection prevention control organizations for network and also continuous education. One of such organizations which is very popular in India is Infection Control Academy, and you can become not only an active member but also a contributor to the improved IPC system in India. You can also actively participate in the discussion forums, and don't forget to complete your assessment within the stipulated time so that you can gain your certificate of completion. Thank you. Thank you for your patient hearing, and I am sure this particular module is going to help you in understanding infection prevention and control as a subject, as a science. Thank you very much and have a great day ahead.